of Tennessee's closely guarded secrets is how many of our elderly in nursing homes and other long-term care facilities have become sick or died as a result of COVID-19.
So why is that information being kept from the public? Tonight, News Channel 5 Chief Investigative Reporter Phil Williams continues to ask the questions you want us to ask. Phil.
Well, Vicki, our News Channel 5 Investigates team has heard from viewers upset that they cannot get more information about the scope of the COVID-19 problems in some area nursing homes. We discovered that the governor and his administration talk a lot about transparency, but on this issue, they don't exactly practice what they preach. From the earliest days of Tennessee's COVID-19 crisis, when a Gallatin nursing home had to be evacuated in the dark of night, information has sometimes been hard to come by.
That says they don't care. It really is. It really seems deliberate indifference in this. It's like, we're not going to tell you anything.
Even now, Governor Bill Lee and his team will not say how many nursing home residents around the state have become sick or died.
Do we know exactly how many residents are affected?
I'm going to let Dr. Piercy answer that.
It turns out that's information that Lee's Health Commissioner, Dr. Lisa Piercy, and her team are keeping to themselves.
Our contact tracing folks and epidemiologists do know exactly what is in each facility. We do not report that publicly.
Last week, the state finally started listing just the names of the long-term care facilities that have 2 or more COVID-19 cases. But that's it. There's no hint, for example, that the Gallatin Center for Rehabilitation and Healing has experienced what sources say is at least 20 deaths.
By withholding infection rates and death rates, they're basically hiding what's going on in nursing homes and assisted living centers and those kind of facilities.
Deborah Fisher heads the Tennessee Coalition for Open Government. Fisher says she's concerned that the state may be keeping such information secret to protect the reputations of the nursing home.
I get that, but at the same time, maybe this is a time when the reputation of the nursing home is less important than the importance of the public knowing what's going on in nursing homes.
I'll remind you that we did publish a list on Friday.
Again, the health commissioner pointed to the department's list of facilities with 2 or more cases.
So families don't know whether it's 2 cases or 200 cases. Why can the state not be more transparent about just how bad the scope of the problem is?
We're just posting those facility names for the public's benefit. And we took our cues from many other states that are doing the same.
But we checked, and the state of Georgia lists every long-term care facility that has even one COVID-19 diagnosis, listing the exact number of cases in each facility and the number of deaths. So we pressed the commissioner.
Can you tell me why you could not be more transparent and give the exact number of cases?
If that becomes a need that we have later down the road, we're open to considering that.
And tonight, in an effort to force the issue on what's happening in our nursing homes, our News Channel 5 Investigates team has now filed an official public records request that by law could require that information to be disclosed. You can see my full exchange with the commissioner right now at newschannel5.com.